Hi, I'm Brian Clark, physical therapist here. I'm actually a clinical coordinator for Helen Keller Hospital, work here at the Well Care Center. What we're going to do today is just kind of go over to you some pre-operative training on a total hip replacement, just to kind of set your mind at ease, make you feel more comfortable about the surgery that you're going to be having. A lot of the doctors will require this so that you feel more at ease with what you're about to go through. So total hip replacement, pretty much what you need to know is with a total hip replacement, they are completely replacing the whole hip bone. So I'll just kind of demonstrate with my hands. So on your pelvis, you have kind of a half circle. Then your hip and your leg fit in here, and that's the ball. So it's a ball and socket joint. They do cut the ball off, and then they put a new one down, and they just hammer it right in. So most people with the total hips that we see feel instantly better after surgery than they did before surgery. So it's kind of a different pain. The arthritic type pain is gone. You do have a little soreness from the surgery itself, but I get very few complaints. Most people are very happy with the surgery. If you have the early morning surgery, which is what we prefer, we will get you up that day. And when I say that day, we're looking at around 3 o'clock, 3:30. Come in, get you up, sitting up. We don't want to risk any side effects like blood clots, pneumonia. We don't get very little complaints of pain. It's more a little nausea, a little dizziness, that kind of thing. When you get up out of surgery, or when you finally wake up, you will have a foam, they call it a foam hip abductor pillow. It's just a large triangle shaped piece of foam right in between your legs, and that's to keep you from crossing your legs over each other. Most people that we come in contact with, they just have complaints of having to lay on their back for so long that first day. But after that first day, we'll be up and down and you'll be feeling much better. So we will come in the room that afternoon, take the pillow out, and that'll feel good. We'll kind of move your legs around some, sit you up on the side of the bed. There'll be 2 of us at all times, just in case there's any problems, anything's bothering you. While you're sitting on the side of the bed, we'll have you kicking your leg up and down a little bit, kind of moving around some. We'll stand you up with the walker. You will be allowed to put weight. A large majority after this type of surgery, they will allow you to put full weight on your leg. Sometimes there's some circumstances where they tell us to back off on the weight bearing, but majority of the time, probably 80% of the time, we can put full weight on it. So let's say I had this on my leg here, my right leg. You're allowed to put full weight on it using the walker. We like the handles to be about waist height, pushing your weight through your hand, and then back off of it. The first day we might take 2 or 3 steps and that's it. Now with the anesthesia and the pain medicine, that leg's very buckly, so don't trust it that first day. That's why there's 2 people on either side of you. It may try to buckle a little bit on you just because you don't have full feeling back in it. It feels kind of strange. Usually by that 2nd, 3rd day, you're up and down. Most people can get themselves from laying down to sitting on the side of the bed pretty much by themselves, maybe just a little assistance. You'll be able to stand, get in and out of a chair, walk up and down the hall with somebody just kind of standing by your side, holding onto your arm a little bit maybe. There are some precautions with the total hip that we like to go over. Very important, you never want to bend from the waist down. They like about no further than 70 degrees. So you can bend forward, like brushing your teeth, doing your hair at the counter, something like that. If you drop something in the floor, it's going to have to stay. You cannot bend way forward because it puts a lot of pressure on the hip where they did the surgery. So you can stoop a little bit, and that's fine. That's no problem getting up in and out of the chair. Do not bend forward. Also, they don't like you crossing your legs. So they don't want you, a lot of people are in that habit of crossing their legs. And that's why when you're laying in bed, they will keep a pillow between your knees. When you get home from the hospital, I highly recommend pillow between the knees. You just don't want to cross it. It will put some pressure and it'll bother you a little bit. The third thing they don't like is a lot of twisting on the hip. So that twisting motion really irritates the hip. If it hurts, don't do it kind of thing. It'll let you know what not to do pretty much. But a lot of times when you would see this is getting in and out of the car when people go to get out, that right there. So when you're getting out of a car, keep your legs together and kind of baby step it. Just kind of inch your legs around. With a walker, we see it a lot. A lot of people when they're turning a corner will try to do this. And so I really emphasize the baby steps. So really kind of take it easy that first few weeks, be real gentle with it. That's pretty much your only precautions with the total hip. Again, like I mentioned before, most of the people we have with the surgery feel better after surgery than they did before, so they're doing great. I see very few people that keep a walker longer than about 2 weeks. Then we try to progress them to a cane. With therapy, you have your options of you can have home health therapy. They can come out and work with you a little bit at your house with the nursing. If you have trouble with transportation, some people will go to inpatient rehabilitation. You can stay for a week, or you can stay up to 3 weeks. And the social workers and discharge planners at the hospital will talk to you about what you want to do with that. And then also, so we have occasionally people like to come straight to outpatient therapy, a little more aggressive, working on stair climbing, getting out of the car, working on some of the machines for strengthening and that type of thing.